Hi, everybody. Welcome to Be Empowered, the podcast. This is a podcast in which we dive into the realities of healthcare and entrepreneurship. We offer our opinion, unfiltered, unapologetic, and always with a dose of empowerment. We're here to amplify voices, yours and ours, challenge the status quo, and explore what it truly means to thrive. So let's get into it. I'm Dr. Santoshi Balakota.
And I'm Dr. Shala Mokta.
And today we're going to be talking about mental health in medicine, which is a very big topic. I feel like it's a topic that a lot of people suffer from, but not a lot of people want to talk about it because of the stigma that's associated with mental health and mental health crises in medicine. So in this episode, we'll talk about, the overview of the importance of talking about mental health in the medical field. And we'll do that to kind of explore what the current challenges are and what the state of mental well-being amongst healthcare professionals is, as well as, maybe come up with some solutions. So before we start, Shella, do you have any examples of when burnout or mental health was an issue in your training or even after training?
Yeah, I think burnout was always an issue. I remember PGY2 was a very difficult year. You start your intern year, that is difficult, and then you go to PGY2, that is, to me, was more difficult because you have longer hours in the hospital, you have stroke codes that are very crucial to attend to in a timely manner. So it's a very high stress situation, and I remember that there were times that I felt that I wanted to quit and choose a different specialty, or not even specialty. I thought that to quit medicine altogether. There were many times that I thought maybe I should go to consulting, do something else. And I just resisted and continued. So that was during residency. And then even after residency, fellowship was okay. I didn't have any complaints during my fellowship. It was, again, long hours, but I really loved my field. So it was a good time for me. During attending life, I did have some times that I was burnt out also. And I felt that the motivation and the enthusiasm of the job was kind of disappearing. I felt that the job is becoming kind of routine and robotic. And that's when I started diversifying and doing something else because I felt like this is not sustainable. What about you?
Similar to you, I think burnout's always been an issue for me, even like in pre-med, even before training, because you have so much anxiety about tests, about GPAs, about MCATs. It's always one thing after the other. So I'm already an anxious person. So during that time, I was like even more anxious. And then, of course, depressed when, you start applying to medical schools and it's difficult to get in. Once you're in medical school, again, it doesn't stop. It's like tests, shelves. You're always studying. You're always trying to get those top scores on your tests. So there's a lot of anxiety there. Again, a lot of burnout because you're literally studying for like 16 plus hours every day, especially when it comes times for the USMLE, because we all know how important the USMLEs are. So, it's nonstop. Once that's done, it's like you're studying for the boards. So all of that testing and just trying to sit and do all this book learning for me was very stressful and burned me out. And then you come into training, and I found residency to be really, really challenging, at least the first 2 years. I think after that, it got a little better. But there's such a steep learning curve that I feel like if you're not stressed, I don't know what's going wrong. I feel like it's just kind of normal for people to be that stressed out, and no one really talks about it. There's no acknowledgement that this is very hard. And in many ways, it's really screwed up too, because we should not be working that many hours back to back, trying to take care of patients. Because the other thing that adds to the burnout is making sure that you're not hurting people. It's always that anxiety about malpractice in the back of your head as well. And I think that has translated over to attendingship now. Now things are much better, I think, just because of the way I have my job set up. I do a lot of part-time contracts. I do locum. So I think it's a lot better now. However, I think that stress in the back of your head about malpractice is still there. And then, of course, the bureaucratic BS that we all have to deal with, I think that definitely adds to ongoing anxiety and stress. During COVID-19, we saw a big rise in this as well among health professionals. COVID-19 pandemic was unprecedented and changed a lot of things. There was a lot of anxiety, insomnia, depression, trauma. I think a lot of people still have PTSD from it. I know I do. It's an already stressful situation, or a stressful profession rather. And then, you throw in the pandemic, and I don't think we're fully recovered from it as healthcare workers.
Even before the COVID-19, or even outside of COVID-19, there are surveys out there, especially done by the American Hospital Association, that shows a significant proportion of healthcare workers experience mental health issues. And like 93% reported stress, 86% reported anxiety, 77% reported frustration, 76% reported exhaustion and burnout. Again, more than 70% reported feeling overwhelmed. So these are really significant numbers.
Approximately 25% of physicians report experiencing ongoing depressive symptoms. Up to 9% have suicidal thoughts. Although, I don't know, I feel like that's an underreported number. I think ultimately there's a lot of stigma around asking for help or saying you're struggling. So I don't even know if I believe this 25% or 9% number, but that's what we have right now. And even despite those challenges, only 19% of physicians actually seek mental health attention, which is concerning because we're in a profession that's supposed to be helping others. And how can you help someone else if you can't help yourself?
I think because, as you said, there's a stigma around it, and then it has to be reported. So when you go through that credentialing and getting privileges into hospitals, there are questions that have you suffered from any mental health issues or mental health problems? So most physicians, even if they do have mental health issues, I'm not sure if they report it because then it becomes a negative thing in their profile. So a lot of people don't seek mental health professionally. They don't seek help, or they just kind of hide it and cope with it in different coping mechanisms. So yeah, I agree with you. It's underreported for sure.
That thought in itself is very depressing, right? We're supposed to be taking care of people. We're supposed to be helping people, yet it's difficult for us to get help for ourselves because you have to report it. You have to, every time you do credentialing, you have to report if you suffer from mental illness. Is looked down upon, which it shouldn't, because as healthcare workers, we know that depression, anxiety is just like having hypertension or diabetes, and you do need to treat it before it gets worse. But for some reason, we're always like dinged for having it on our medical records, or even like having a history of it, like if you were hospitalized due to some mental health condition. I don't know. That stigma, I feel, is very unfounded because, it's like saying that we're supposed to function as robots. Like, this is not robotic work that we're doing. It's not normal to see people getting hurt and dying on a daily basis and have no effects from it. And that's not even us. Nurses, other healthcare workers in general also have burnout and stress. The surveys that I saw reported that about 64% of nurses are burnt out and stressed due to their job, although I think that number is also probably higher. And a lot of them still have anxiety and depression from the pandemic, ranging from 23% to 61%, which again is probably underreported. But we don't have clear numbers because it is so stigmatized.
And these numbers are increasing. It's not getting better because it's not being dealt with, because we don't talk about it and it's a stigma. So people don't seek help, and then the numbers are rising, even though these are underreported numbers, but they're still rising. And in 2022, 46% of healthcare workers reported feeling burned out often or very often. And that was up from 32% in 2018. Again, that's a significant increase in just a few years.
Speaking of burnout, maybe we can define burnout, because I feel like a lot of people say, I'm burnt out, but what does that actually mean? So the World Health Organization defines burnout as such. It defines it as emotional exhaustion, feeling drained, fatigued, and overwhelmed, often leading to reduced ability to cope with daily tasks. The second point they make is depersonalization, where you become very cynical. I feel like this applies to me quite so much, where you develop a negative, detached, or cynical attitude towards patients, colleagues, or work itself, kind of like, oh, why does that matter anyway? This things are going to go badly regardless. So I think that's an example of that kind of thought process. And then lastly, reduce personal accomplishment, where you're feeling ineffective, unmotivated, your work lacks meaning or impact.
I see this in the majority of physicians and colleagues, friends. I mean, who doesn't have any of this? Maybe not all the time, but most of the time feel this way.
It's difficult not to feel this way because, quite frankly, our jobs have changed so much that, one other point to this is something called moral injury, right? Where we get into medicine to do one thing, but the reality of it is something else. So you feel like that actually injures your morals and ethics. So that's a different kind of injury or trauma that can lead to also burnout. You feel emotionally exhausted. You want to do the best for your patients, but a lot of the times you can't. And so then you develop this like cynical attitude. And as that goes on, it's hard to feel that your job is meaningful anymore. I mean, we just had a conversation about this before we started recording this. It's feeling unmotivated, feeling like your job doesn't matter. And what the hell am I doing every day? I wake up and I just do this robotic function.
Yeah. And ultimately, again, that affects the patients is because of this exhaustion and feeling fatigued and overwhelmed all the time. Then how do you provide the best care that you can? It's just, we still do. I feel like despite this, we still start our job and we provide, the best care that we have to give. But ultimately at the end of the day, again, you just feel exhausted and overwhelmed. The feeling doesn't go away.
No, the feeling doesn't go away. And there are several causes of burnout in medicine. We probably don't have to name them. If you're listening to this, you probably already know, but the long hours with the excessive workload, administrative burdens, and lack of autonomy. You have the emotional strain from taking care of very sick people. You see a lot of good people that get sick, or, I almost feel like the worst things happen to the nicest people. So that's emotionally draining as well as the provider. On top of that, there's sleep deprivation, there's shift work. You're sometimes on call every night for a week. So that also can lead to some kind of encephalopathy and heightened emotions. And then as you're going through all of this, there's oftentimes a lack of support from your institution.
I think that's a big one. The lack of leadership support, bad treatment, gaslighting, things like that we talked about in the last episode, the toxic workplaces. That adds a lot to the table, because if you have a stressful work environment or the job itself is hard, and there are a lot of jobs that are hard, but if you have a good support system and you have people in leadership who are supporting you, then sometimes it feels better, right? Because of my good support group, I will stay in this job and I can do it. But when you have lack of institutional support, their attitude is, it is what it is. Can you do it or not? Basically kind of functions on ultimatums and productivity, and you have to do more. And if you don't do it, somebody else will do it. This kind of attitude adds a lot to the stress and feeling unmotivated.
And I think the other effects of burnout, of course, patients are affected, but you yourself have an increased risk of depression and anxiety. When you're feeling unmotivated, you're also more likely to have decreased job satisfaction and increased turnover, meaning doctors are leaving the field more often than they were in the past. When you're tired and exhausted, you're going to have higher rates of medical errors. And if you're not seeking help, then as you said, you do other things to cope, right? Like substance use. You can even have suicidal ideation that no one knows about because you're not seeking help from this. And unfortunately, we had a few people in my residency who did commit suicide, and that's not something that is unheard of. We see this in the news like at least a couple of times every year.
It's really sad. Again, That's why we're talking about this, and I hope that this podcast helped. That's why we're going to talk about some solutions to address this problem. So some of the solutions could be institutional solutions, and others are individualized solutions. Some institutional solutions could be basically support and resources from hospitals and medical institutions to implement some programs to support the staff, their well-being, including some counseling services and stress management workshops. And these should not be reportable. For example, there are some mental health professionals or entities that work for employers, but to be honest, I'm not sure if they report what's been told to them. I don't know. What do you think? Do you think those entities report?
I think so. I think they do report back to your employer. I think anytime you're going to a resource that's provided by your employer, you're always risking them reporting back to the employer. And I know that's not very HIPAA compliant, but maybe I'm just being cynical, but I just don't have a lot of trust in a company that is hired or resources that are hired by your employer. I would probably seek something out on my own. On the other hand, mental health resources are also expensive, so I can understand why people would not want to spend the $200-$300 per visit, because sometimes they're not even covered by insurance, and go with the resources that the institution offers. So it's kind of like you're between a rock and a hard place, right? Like, you want to get help, you want to do it discreetly, but it also costs a lot of money. So I think we need to encourage help seeking, but we also need resources, not just for healthcare workers, but for the general public. Now, I think this is a bigger issue, right? That mental health access isn't as accessible. For trainees, the institutions do need to put something in place where you can go and you can seek help, and it's not reported back to the board or the governing bodies or your hospital. And I think if that happens, then we will reduce the stigma around mental health and the stigma around help seeking.
I agree. So if you do need help, I would say, even if you go with an entity that your employer is recommending, and make sure that those are not reported back to your employer, so you can be yourself and talk about all the problems that you have. So make sure that it's in writing, that is not reported back to the employer.
And I think ultimately the bigger picture here is that we need systemic change, right? Like reasonable work hours, adequate staffing, all of these things that contribute to this burnout, this added stress, this anxiety among healthcare workers. But ultimately, we're not going to get from A to Z. I think we need to make small, incremental, systemic changes. Unions right now, the residents are unionizing, which I think is a good thing. And I think doctors should consider doing so as well. And I think if we can advocate for some of these systemic changes, we would be able to tackle this issue of burnout and mental health. We also overall just need to reduce the stigma around it.
And I would say, even when you are looking for a job, in the steps of contract negotiations, you should ask the institution, what steps have you taken to address burnout? Because there are some places that have, for example, wellness programs. They every now and then they have retreats, for example, or things like that. I know in the tech world they have multiple retreats per year to address burnout. So you might want to ask that when interviewing for jobs, because that makes a difference. It gives you a clue what they're expecting of you and what you expect of them.
Yeah, and I think just make sure that what resources they have also are beyond like mental health modules, because I think we've all done that, right? Like,
yeah,
I had so many lectures during training about the importance of sleep and mental health, and it's like, okay, it's like they're giving you something just so they can check a box. So we need something more than that. And resiliency training, which I think is very insulting, because if you've gotten this far, obviously you're a pretty resilient individual. So you being stressed out or anxious or sad or burnt out is because of the way the system is set up. It's not because you're not resilient. So I think all of those things that you mentioned, Charlotte, are important when you are looking for a job to see what they offer for burnout.
And then there are some strategies individually that someone can take. For example, self-care techniques. So just stay active physically, adequate rest, do mindfulness practices, and have hobbies. That's another big thing to address some of the mental health issues that is going on in the healthcare.
Yeah, and I think that's easier said than done, especially if you're in training. You're not going to find time to go to the gym as much as you used to before all of this, or sleep. Because if you have one day off in a week, you want to run your errands, you want to do like the things around the house. You don't want to just sit and rest the whole day. But what I think for me, what was helpful is trying to make my life outside of the hospital as easy as possible. If that means ordering in food, if that means having groceries delivered, if that means getting myself to the gym at least for 30 minutes every day, and making sure that I skip out on maybe events to get some rest. I think all of those things for me were helpful. Not saying, do all of that instead of socializing. Of course, I think a big part of it, like you said, is maintaining your hobbies. Also, socializing with your peers, I think, is helpful. You don't want to isolate yourself. So all of those things I think count as self-care. I know nowadays self-care is like a buzzword and it could mean a variety of things, but I think just setting healthy boundaries for yourself between work and home, also enjoying the things that you enjoyed before you became a med student or before residency or before training, I think that's helpful.
And then the other one is building very good support network. I can't even emphasize how important that is, especially in telemedicine job. And you and I had telemedicine jobs. In telemedicine jobs, you feel so isolated. And so the best thing is to form that peer support group and kind of seek mentorship to navigate some of the challenges. Talk to your peers, your colleagues, to your friends, share your stories with them, hear their stories and learn. It's very important to learn from each other's experiences, and change. So to change your course, if you are trapped, you feel trapped somewhere in a job that is not fulfilling for you, just networking and talking to other people will help you.
As doctors, we don't network quite as much. I don't know what it is. I think it's like you don't want to look sleazy like a business person networking, but I found networking to be great because it can open so many doors in terms of other opportunities. Because networking with someone in person, even if you're not doing it in person, even just reaching out via LinkedIn or whatever can open doors to other jobs because you never know unless you make that contact. So I think networking is not emphasized as much in our careers, but I find it to be super important. It's also good to have that continued professional development, have some realistic career goals. If you're doing something that you don't think is fitting well with your everyday life, then maybe change those career goals to prevent this feeling of stagnation and burnout. For example, when I switched from my academic job, my big thing was I didn't want to take any more call. I wanted to sleep through the night. Like to me, that was contributing a lot to my burnout. So now I don't take call. I've kind of made my contract or my locums positions where I don't do overnight call. The other thing for me is outpatient medicine. Even though I loved seeing the patients and getting to know them, I did not enjoy prior authorizations, talking to insurance companies, peer to peers. There's like 50 things that are uncompensated in the outpatient world. I just didn't want to deal with it. So now I'm mostly just do inpatient medicine. So things like that, figure out what's burning you out and see if you can make changes to those things to the best of your abilities.
Right. We are actually like-minded about the calls. I'll share some of my changes that I had to make for my job to be more tolerable, my life to be tolerable. So just like you, I didn't like night calls. So I didn't take jobs that require night calls. I don't like outpatient either. So I'm doing mostly inpatient. Although I found another job that is very niche in the outpatient setting, that I love it. it. And I'm also diversifying between, I would say, 3 different things. My pay is higher, and my mental stress is much lower. And I changed my mindset, basically setting boundaries, setting goals for myself, changing my attitude of, this is going to be the job forever for me, or things like that. Because I think that was the factor that was affecting my mental health the most. It's just I wanted something to work, and I wanted it to be perfect, and I wanted it, the way I wanted it. So when I changed my mindset, it's like, okay, if I can't make this job work for me, then I will go find another one. And I did, and it was great. It was the best decision I made. And then I also started back on my hobbies. So I paint, I do oil painting. And my other hobbies are hiking, traveling. We love traveling. Finally, I actually started Pilates and soccer. So this soccer is a new thing. My gosh, I really need to build my strength. This last Sunday, the ball hit my diaphragm. I couldn't breathe for a few seconds. But it was great. I really, really have fun out there. And it's amazing how nothing is on my mind when I'm playing soccer. It's just even after a really bad day of work, I go to the field and I practice with my friends, and it's a co-ed, and there's nothing else on my mind during that time. So it's amazing. I do spend a lot of time with my kids and my husband. We have very good routine, play Uno almost every night, the 4 of us. So and I made these changes myself because I recognized that if what I was doing was not sustainable, and it was affecting my sleep, it was affecting my well-being. So I made a lot of changes in the past, I would say, year.
I think, all of that sounds awesome. I think the big thing I'm hearing is you have to set clear boundaries. That goes without saying. You have to set boundaries, emphasize the importance of your mental health, and you have to proactively ensure the well-being of yourself and your family, because if you can't do that, you can't offer quality of patient care. And at the end of the day, like, you don't really owe anyone anything aside from the patient. Like, not your boss, not your hospital institution. They'll be okay, but you have to take care of yourself so you can also do your job and take care of patients. And I think if you're in a job that does not support or understand that, it's time to move on. Make some other changes that can allow you to do your job, but also not lose your mind while you're doing it. It's going to be hard to have longevity in this career, because I got to that point as well where I'm like, if I don't make a change, then I'm leaving. And I think we're seeing that a lot more in healthcare.
I really encourage the listeners to prioritize their mental health, utilize available resources, reach out to us. We'll talk more about this in future episodes. Please share your stories, reach out, and we're here to help. Thanks for tuning in to the Be Empowered, the podcast. If you enjoyed this conversation, don't forget to subscribe, leave a review, rate this podcast, and share it with someone who needs it. Stay strong, stay empowered, and we'll see you next time.